Good afternoon, everyone. We're going to go ahead and get started since it is the appointed hour. I thank you for being here. So, I want to take a few minutes and set the stage for what patient room next means to me, and so you get a little sense of at least how I think about it. Not too much detail on technologies per se. This is a passionate subject for me. You could talk, for hours on it, and have been working around this space now for nearly 8 years, both at Intermountain with the Transformation Lab and the Innovation Lab there, as well as here at Sirius. But I really want to get to, after setting the stage, at least how I think about it, is I really want to ask you some questions. So if you would look around and try to find your raise your hand button, so that if you want to comment or answer questions, which I would really like you to do, I really would like this to be interactive after the first few slides, and to hear your perspectives on this, because it's really helpful, and I think we all learn from each other, and everybody's a little bit different in how they're thinking about it. So, a few minutes of me telling you how I think, and then I'd like to hear from you. So, let's get started. So, the first thing you need to understand when I talk about patient anything, I start using the word people. And people has a definition for me. People is a population. We talk about our served populations or accountable care populations, whatever it happens to be. That's a population that just might not be the client or the customer or the patient or under the care of a particular healthcare organization, but you still want to reach out and somehow engage with them. Of course, we're talking about traditional patients, and patients are those that you're giving medical care to in some form. But people also includes physicians, nurses, and other caregivers that are associated with the delivery of care or the interaction with populations and patients. But we also include payers and members in this where appropriate. So people is a very broad definition. The other thing, from my perspective, this is how people want things to work, right? For my view is that people want it on my schedule, anytime, and I don't care if you're a physician, I want it my way. If I'm a patient, I want it my way. I want it integrated into my life. I want it to understand me. I want to access it anywhere. I want to be engaging, and I want to be transparent, especially where the cost and fees, around that are concerned. And so hopefully that makes some form of sense. So when we start looking at patient room next, at least from the Sirius perspective, we put it in kind of this view. And I think it's pretty similar to how most people would view care. There's really this, we call it running wild, right? You're out there, you may not be sick, or you just get the very common things. And you do retail drop-in, you do remote or telecare. You may have an app that does some of this. And the important thing to note here is that's where we can have the greatest impact on care. It's the time when things aren't as serious, and we can get them healed or take care of their immediate issues and try to get them back into the wild and doing what they do. It's also the lowest cost care that we have. As you move to the right and you move into the ambulatory and more traditional inpatient services, and then on to both transition rehabilitation or long-term or hospice, the cost gets more expensive, and it gets harder and harder for us to impact care. So this is how we look at this idea of a continuum of care. Inside of Sirius, we would call this the continuously aware future of care. How do we connect from the far left all the way through over time? And by the way, I will be clear, we don't have all the answers, but this is how we're viewing and looking for solutions, during this opportunity. So, what is patient room next? A couple things I want you to understand, at least from my perspective. The patient room is wherever we're treating the patient. It could be the very traditional inpatient room. It could be other places in the hospital or ambulatory setting, or it could be hospital at home, attend in the parking lot, long-term care. I will tell you that from a Sirius perspective, we're spending most of our time focusing on the fairly traditional inpatient and ambulatory care space. And that's mainly because that's where our customers tend to be. A lot of people talking about hospital at home, a lot of people and organizations are beginning to figure out what does that mean. They've certainly done some remote monitoring of some kind, especially around cardiovascular and sometimes diabetes and a few other things. But the whole idea of treating patients at home is still kind of evolving, and people are still trying to figure out what it means and exactly what to do. There's security issues around it. There's certainly connectivity issues around it. The other problem has kind of been most organizations aren't built with a workforce or a clinical workforce ready to respond to those at-home kind of needs. My primary care physician, for example, really only deals with me when the system, says, "Hey, there's a new lab result," or I have contacted them for a prescription, or I'm coming in to see a visit. They don't necessarily, follow me on an ongoing basis. And so, is that a call center? Is that a clinical type of call center, like an EICU kind of mentality would use? How does that going to work? And so that has created, some, it's not barriers, but some timing issues on when we'll get to hospital at home and those kinds of things. So we're focusing, and probably would have more of this conversation on maybe the more traditional inpatient. The second thing to know is we use, at least at Sirius, we use the word next, patient room next. And why next? I don't have a clue what the future is. Being an ex-chief technology officer, even in the innovation space, my crystal ball was always broken, had cracks in it, duct tape was often in the shop. I can't see that far out. I can see near term and have some idea what's, now and maybe even a couple of years out, or at least some idea. We certainly are thinking about how do you prep rooms, for maybe that 2 to 5 year kind of thing and what you might need to be prepared for. But we really don't know what's coming and how technology is going to evolve and taking care of patients somewhere in this patient room. The third thing you should know from a serious perspective of how we view this is that it's an ecosystem. You don't go out and buy a patient room next or a patient room of all these cool technologies. It's just not out there. It's a unicorn in my view of the world. But there are solutions, and so you put these in buckets. So buckets for me are machine vision, machine audio, content delivery, which includes everything from making sure that clinicians have the information they need when they need it, as well as that engaging distraction piece for the patients, which would include patient television and those kinds of things, digital whiteboards, as well as content delivery to families and others who are engaged in that patient's care or want to be engaged in that patient's care, and how do you inform them? Then we have remote and telecare, types of things. We have engagement solutions, which would also, encompass, the mobile app world and those types of things, those digital app kind of worlds. And then the last bucket for me is censoring. There's going to be 1,001 sensors. We already know what IoT in general has been doing and proliferating in sensors. And there's going to be a tremendous number of other sensors that are going to come out. For example, one that Sirius is kind of working with is a touchless vitals monitor, so that you can monitor certain amounts of vitals, being touchless. It's a radar-based device, fits behind the bed or behind a chair. There are going to be many of those, and it doesn't matter really which one you pick. There's going to be a lot of them, and you're going to have to figure out how to support a set of them that do certain things. So then we get into questions like, well, what do you do now? And for us, it's an ecosystem, so you can buy pieces and parts of this and put them together, and eat this as you can afford to, as the infrastructure can handle it, as you can roll it out, as the staff can handle, the changes that come with it. Because the other thing you have to understand about, technology around a patient room, it's not just about technology. Almost all of this will cause some kind of clinical process change or workflow change. It'll cause something to have to be changed. Well, I'm a technologist, and as a technologist, I'm not a doctor, not a nurse, and I'm a clinical person. I can't tell you how to change that process, but that is part of any of these technologies coming in. So we do it as an ecosystem, and able to do it in pieces as it makes sense. Well, here's what you don't want to do in pieces. As you think forward of what, your patient room next, or the technology you want to bring into traditional treatment spaces to improve care and efficiency and those kinds of things. You don't want to piecemeal the parts of infrastructure that make you go into the room every time something new comes along and somebody has to go in and change. Somebody has to, lift the ceiling tiles or drill holes in the walls or run cables. That's what you don't want to do any more than you have to. We need to do that hopefully once, worst twice, and then we bring in the pieces that attach to that to bring on these new capabilities. So we're talking about things like, running networking cables. Is there a PC in the room that's not the traditional clinical use PC where people are in and using the EHR? Are there needs for other a computer, a server, computer, edge device to do those kinds of things, so that we can come in later and put in mics and speakers and cameras and a dozen other things that fall into patient room next. Those are the things that you really need to start thinking about. But you should be doing it on some kind of thoughtful plan that says, if we look a few years out, these are the things we'd like to be doing. Here are priorities of the things we want to do first. And then, let's get an infrastructure put in place so that we can touch the rooms once. It's just not viable to continually shutting down rooms to redo them or to rewire them, or to come in and create that dust and environmental issues that often come with, with having to work in, patient care kinds of spaces. So that's what patient room next means to me per se. Now, if you look at where we're focusing on what kind of capabilities, we're really focused around 4 big goals or high-level capabilities. And these are the real high levels. We're trying to drill these down. But the first one is, how do we make it an easy button? If you think about all the technologies that are out there, and again, I'm sure most of you have done, some look-see at what's out on the market, you realize that there's so many of them, and they're all different. They all do different things. They don't necessarily interact well with each other. They all have their own UIs. They all have their own data backends. They're just disparate systems. So the first goal for our view of Patient Room Next is, how do we begin to create a single pane of glass, or a single way to interact with all of these systems? So if I'm getting alerts from a system, I get alerts only in one place. I don't have separate alerting applications. And it really doesn't matter what that is to you, if it's your nurse calls, via the nurse call system and pager system, or if it's via, a mobile app that, you might have that can take alerts. It's just, we need them all to go to one place. That is an example of this pane of glass. And if physicians are, moving around, or nurses are moving around and they've got to interact, we don't want them to just log on to another application and another application, They already have the EHR, and they probably have several others. We don't want to have to go in and so interact with this, piece for clinical care in the room that does this and this one that does that. Single sign-on's nice. It'll stop the sign-on problem, but it doesn't change the fact that you could have, we have 8 solutions, I believe, right now in this space. It doesn't change the fact you could have 8 applications up. And so we need to be careful that we don't create more workload. And so we want to create this easy button, or this, and it's hard to do. I get it. But as much as possible, create this easy button experience, so that all these solutions kind of disappear, and yet they're doing their job. The second thing we want to look at is dealing with data. We have historically done what I call automated intelligence. And that's after the fact. That's a lot of data warehousing, very traditional stuff that we've been doing. What we want to begin to move to, and where these systems that you're going to start putting into Patient Room Next come along, is how do we do augmented intelligence? And we don't want to take the role away from a physician or a nurse or any other caregiver. What we want to do is present them with the best information we can. What do I know about this person right now, both historically? What does the world know about their type of situation that might not be specific to that patient? And what can I tell you that the sensors, the room, all the technology we have going on are saying right now? And how do I bring 5 different systems in the room together so that the information from 1, 2, 3, and 4 at that instant in time might be telling me something more than any one of them can tell me. So we want to look at that as a goal. The third thing, and this is very passionate space for me, is how do we do automated documentation? I've had a number of experiences of family members being in the hospital. I've had 8 surgeries so far. And one of the things you see is that specifically nurses, but it's true for physicians as well, spend way too much time having to peck on the computer to enter the things to satisfy all the documentation requirements. And we understand the value of the documentation, both from a payment perspective as well as a treatment perspective. But there has to be a better way to do some of these things. And so can we use vision and audio and censoring to create documentation so that we can present them with, this is what I think happened, this is what I think we know, is this right? Or do you need to correct it, and then submit it, for permanent store. But make it so that it's easy and they don't have to walk around with notes in their palms, recording vitals and doing all these things. And then the last thing is, how do we flex spaces? A lot of healthcare organizations are still building hospitals. But the question is, how do we let spaces go from a traditional patient room to an EICU? How do we let all of that move out into the parking lot in a tent in the COVID scenarios? How does all this begin to move home? How do we let our spaces flex with, need? And so those are the 4 big goal areas that we want to look at. So hopefully that makes sense of how we're looking at this world and things that, at least from the Sirius perspective, we're trying to accomplish. But what I'd really like to do now, and again, I could give you my perspective on this and some of the technologies we're looking at and where I think, things are going to go. But I'd really like to stop and ask you a few of these questions, right? What is your organization seeing as the future of patient care? How did COVID change those visions that you might have had, 12 to 18 months ago? Where do you think care is going to be delivered in the long term? Is it going to be home? Is it going to be staying, and let's just talk out 2 to 3 or 4 years, does it stay where it is now? Do you think it's going to, move out? Do you think it'll be more ambulatory? What do you think? And then who in your organization is really leading these changes in care model? Is there someone? And if it is, who is it? So I'd like to open it up. If you can find raise your hand button, and if you can't, let us know, but we'd like to hear, from those that are participating. Wow, no hands? Well, while I'm waiting for anybody who wants to raise their hand and make sure that we can click you in here, I'll tell you what I see many of our customers that I visit, are seeing around this, and it'll be interesting to see if you would agree. But we see a lot of organizations that are, again, trying to figure out how do they move more home. But I don't know if they see that is the only way to do it, the way that it's really moving. They really see, I need to be more hands-off in the traditional patient spaces. So COVID, if it taught us one thing, if it seems, is that I have to figure out how not to go into the room all the time, how to get more vitals and information, let censoring do more of the job. How do I let virtual rounding, many of those things? How do I do machine visioned kinds of watching and caring for the patient? How do I let them do as much as they can for themselves, ask for things and interact? So we saw more of that, and so it seems right now that the future of care at this exact moment is focusing on virtual rounding, and telehealth, right? How do we continue to do that in patient rooms and continue to do that? But I think it's quickly evolving, and this space for us has gotten hot in the last 12 months as people have started looking and saying, how do I make my rooms? How do I take a camera in the room and apply vision AI to it and start doing a number of things, right? I can watch, for certain things happening, whether that's, potentially falls, whether that's telesitting, whether that's monitoring vitals and chest movement, and are people still alive and breathing? Even though I'm not in to check on them, and they may not be on, high-end equipment and cardio monitors, traditional cardio monitors, and those kinds of things. How can I start doing more of those things? And what will be the next set of things that are coming along? And how can I make that as automated as possible without physically going in there all the time? And what's interesting about this is we talk about how do I do more and not go in as much? We still want the patient to feel better care for. And want them to feel like, hey, I'm getting the best care. People are caring about me. Hey, they know what's going on, and they know I'm not feeling good, so they're dealing with me on a more proactive basis. Looks like maybe we have somebody who wants to comment. Nick? Maybe. Nick, your microphone still seems to be muted if you want to say anything. Well, while he's potentially unmuting his mic there, where do we see care being delivered in the near and long term? There's going to be a lot of self-care. What will the mobile apps be able to do? And how can they, look, I don't want to go to the doctor. I'm being honest, and I love my doctor. I just don't want to go. It's not is it not convenient. I don't always perceive the value in me having to go in, because I'm just going so that he can check me to, before he refills, set of prescriptions. And so I don't really want to go in. So the question is, how can we make this more delivered in a way that we want it to be delivered? Whether you agree with affordable care or not, it doesn't matter to me. What you find is that it changed the power kind of from traditional healthcare into people's hands. They have choices, and I liked a lot of those choices. I liked telehealth coming along. I liked being able to do it my way. And I think that's going to want to continue. And so I think as much as we can deliver care where you are, when you are, you see the Walgreens of the world, the CVSs, the Rite Aids of the world are all trying to do care in their clinics, those types of things. I think you'll see a lot of care, moving that direction. And who is leading a lot of these care models? It's obviously traditional and clinical, and those who have traditionally been used to doing care models. I am beginning to see, and this is interesting to me, I am beginning to see that IT organizations are starting to get more involved. A lot of IT organizations in healthcare have stopped saying, I'm the tech guy and server guy and speeds and feeds, guy and gals, and starting to say, how do we be part of changing the care process and models? Yeah, you're not clinical and you're not going to determine medicine, but you are part of the solution. So how do I become part of that? And when you start those conversations and people start to see, the IT organization as somebody is not over there trying to make my life miserable and hold to standards that make no sense to me, and start talking about what we need to be doing to really change things, and again, to improve efficiencies and satisfaction and the outcome of care, and saying, so how do we help that? And again, this patient room next concept really starts to move that direction and say, how do we help that? And we start talking about solutions that are much higher than we're traditionally used to, which is, the EHR as an application, or other applications, and the servers and data centers and things. By the way, those things have to be there. And nobody is suggesting that there's not important roles, but those, between cloud and many other things, those roles continue to shift, and we continue to look at the best way to deliver those. But at the end of the day, most of the business doesn't care. They care about how that impacts me doing my job day to day, and how does that impact the care that I'm providing patients and or potential patients that are out there. Anybody want to raise their hand and provide perspective on this? Well, it's an exciting, as we run out of time, it's an exciting space, for me personally, and I think for Sirius as an organization. The machine vision space, again, we just touched on a few of them, but that is moving so rapidly. And there's several companies that out there, probably a number, but there's several that we spend time with that have really done a good job at saying, we have vision coming in, and we've built a platform that it's very easy for us to turn new capabilities. Oh, we want to do that. Well, this is a new capability. It's pretty easy for us to do. Some of them have even gone so far as to do if then else kind of logic with the information coming in, on the machine vision side. Machine audio is very interesting space. Of course, we've had Alexa and, the Cortanas and Siri's of the world that can do some things. A lot of people want to put Alexa in. But understanding medical terminology is very important to this pardon the pun, conversation. It's not just about command and control, turn on the TV, turn on the lights, set the temperature. It's really about understanding what's going on in ambient listening, as well as clinical communication and documentation. So it's a great space, and we have several partners that are clearly doing well in this space because of using the medical terminology to impact that. Content delivery, some of that's been around. We see a lot of our organizations doing things and really starting to think about the e-whiteboard kind of ideas, rethinking what traditional entertainment engagement is, and those kinds of things. And then obviously in the remote and tele, part of the world, those have been around for a while. They've been around for a long time, actually. They've been strong for a number of years, and certainly have gotten their legs, both from a payment perspective, as well as being acceptable and used in technology as a technology coming out of COVID. And so very powerful platforms, for us now. And then how do you engage, customers? There's really, when we think about this other bucket, this engagement, there's really kind of two big pieces to that. One is what we see is the mobile apps, and everybody's looking at, I need a mobile app or mobile presence or even a web presence to that. But the other is, how do you engage them? How do you reach out to people so that they go to those platforms and actually use them? And so we're seeing a rise in capabilities where, you're looking at all the data that you have and saying, hey, and by the way, geofencing, which is geofencing, so that you can say, hey, I want to look at this zip code, I want to look at this neighborhood, and I want to reach out to just the people that happen to be in there. I want to, it looks like, you've had this for some time, you should. And so how do you engage people so that they go use all those platforms that you may have created, whether that's web or digital or otherwise? So exciting spaces, many things you can do. Somebody says, though, what can I do today? The thing to do today is to, organize your healthcare system, your organization, your hospital, your clinic, to think about what do you want to do in the next few years. I think, Sirius can certainly help you with that. But think about what do you want to do and put some vision into that. And then from that, what do I need to do today from an infrastructure perspective? And again, that's a cabling statement, a placement of very key kind of components, so that I can go and, then figure out which of these things do I want to do first, and then go find the right solution, and bring those in. So I appreciate your time today. Again, this is a topic I could go on and on for a long time, but I appreciate you being here. And if you have any questions, feel free to reach out. The Sirius Healthcare team certainly, is happy to help and answer any questions or help you, look for any of these solutions where it makes sense. Thank you.